Good morning. Today we're talking about the thyroid. The thyroid organ is found in the neck area and it's quite large. It goes on the right and the left side. Do you know what the thyroid does? Can it be your thyroid why you are having a hard time losing weight? Let's explore and find out what could possibly be going on. The thyroid is an organ that controls metabolism. Therefore, the thyroid could be hypo, which means low functioning, or hyper, which is high functioning. With hyperthyroidism, you have a few disorders that could come with that. But first, let's talk about the low thyroid function. It could be that as you're aging or situations of life have altered the function of your thyroid gland, causing it to produce less and less hormones, which will slow down your metabolic rate. Some of those things might be seen when you assess the patient, that they're always cold, their skin looks drab, their hair's dull, and it could possibly be also not as thick, their hair. There's other things as well. They gain weight and they feel very lethargic. The hyperthyroid could be a few different things. So you have hyperthyroid, which means that the organ's functioning quite fast. So the person might be real anxious and fast moving, and they are very, their heart rate is fast. There's symptoms that go along with that. But under the hyperthyroidism, there's a disease called Graves' disease. You will know that disease because there's inflammation, and it's usually found, you could see it because the eyes begin to bulge out. So inflammation drives this condition called Graves'. There's a second condition called Hashimoto's. Yes, this condition is an autoimmune disorder. So now your immune system is fighting your thyroid. So you could take medication and all that to help you. A goiter. Do you know what a goiter is? It would be this gland, but now it's enlarged. So you can kind of see it popping out from the sides of your neck. The goiter disorder usually comes from a decrease of iodine. So you can replenish your diet with iodine. Seafood, seaweed, avocados have it. Let's see. Some animal products. So we can talk more about that extensively. All right. Now, the next one that we want to talk about is how your thyroid function is affected, and because you take medication, raw broccoli might not be a good thing to take when you're taking thyroid medication because it blocks the uptake of the medicine. But something that might happen that you might not know, people that take in a lot of carbohydrates, well, these people also block the thyroid function. So try to stay with proteins, plant-based proteins, and vegetables. You can take things like watercress that increase iodine, and fiber, of course, is good all the time. If in doubt, eat fiber. 35 milligrams. I'm sorry, I'm messing up here. 35 grams a day. All right, so that's it. And if we want to talk more extensively about this next week, we're going to cover parathyroid. All right, thank you.